Welcome to Fitness Casual. We help you ditch diets and build habits no matter how busy you are. I'm Andrew Hayes, and with me is the metabolically stable Kat Bast.
Hello, hello.
Kat, we were in person together recently, and we both shared our first, I think it was our first extra large Celsius. So I enjoy a small can from time to time, but this was like one of them. It looked like a monster, but Celsius form. I know that was your first. How did that go for you?
So yes, this is my first time consuming Celsius ever, and I would say I have very little issues with caffeine, but lately I've been only doing one coffee per day. My second one is decaf, so maybe I'm like naturally desensitized a little bit. But this can had 270 milligrams in the whole thing. I didn't think too much of it, and it tastes delicious, so I drank it relatively quickly. And then while we were on this panel, all of a sudden I like feel my heartbeat like in my ears. I'm like, I just hear, and then I put on my Apple Watch, I checked my heart rate, and it was at like 90, and I'm like resting. Like I couldn't be more still with what I'm doing. And then as it's happening, I'm just like, oh my God, like here we go, the jitters. And I haven't felt that in an incredibly long time. Like maybe the last time I drank like a Bang energy drink, I don't know if you remember those, but those had a moment. And then I immediately was just like, one, this is terrible. Like I would never want to feel this again because it's just so unnecessary. But B, I just thought it was like there was something funny about it. And also I was about to get on a plane to go fly. And then I'm just like, oh no. But it really was just the heartbeat. Like I could feel it. That was just crazy. And I was definitely just like jittery, a little bit more like anxious and amped up. But it went away. But I think that was an experience I haven't felt in such a long time. And yeah, I will probably never have a Celsius again.
Yes. We did this panel or the front of the room. You had to leave to catch a flight. And my phone buzzes 30 minutes later, and I'm like still supposed to be presenting, and it's you just like my heart is popping out of my chest or something like that. You had texted
Well, my joke
me.
was, these things say they burn fat, and I actually was like, my heart rate might be so high, I am burning fat right now. I was like, I am in zone 2. It was surreal, but Andrew and I always talk about like caffeine and stuff like that, so I just like had to share that I was like very much feeling it.
It's so funny. My other favorite thing about we were at a conference, there were lots of other coaches there, and all of us have different philosophies and different ways of life, but we all kind of agree on the same thing, which is like, we're human beings, we believe in balance. Most people drink, most people have caffeine, people have energy drinks, people eat sugar, whatever. We all went out for ice cream one night. We're normal, but there was kind of a running joke because we all like to razz each other. Like anytime someone would order anything unhealthy, they'd be like, oh, you put those chemicals in your body? Because that's what everyone thinks, right? They think like we go to a conference and we all just like share lettuce like rabbits. But it's not true at all, right? And I think, yes, maybe we both regret our energy drink choice. But we went out for ice cream Friday night after you left, Kat. It was delicious. So
Nice.
But that it is a really important thing to discuss because there's a lack of education on how to incorporate things like sugar. Insulin resistance is a huge issue. We mentioned this on a recent podcast, but close to 50% of the population is either pre-diabetic or diabetic. Processed foods, you name it. But one of the biggest issues is PCOS. How common it is, how undiagnosed it is, how improperly handled it is. And Kat happens to be, I think, a bit of an expert. So take it away. Where do you want to start today?
So PCOS is a massive topic, and I think if you have no idea what it means or what it even stands for, you've probably heard of it or you know someone who has it. It's incredibly common. It stands for polycystic ovarian syndrome, and you'll see why in a little bit, but one of the biggest complaints about this is it's like the name is terrible and it does not match what the actual syndrome is, because you don't need to have cystic ovaries to have PCOS. So a lot of women right off the bat will be like, well, I don't have that because my ovaries are fine, or they don't know the status of their ovaries. But yeah, so I would say the name is a little outdated, but it's one of the most common endocrine disorders, roughly affecting 5 to 7% of women worldwide, but I think it's much greater than that. It's drastically underdiagnosed, probably one of the most underdiagnosed conditions out there. So who knows how many women are actually suffering with it or have it or have not been diagnosed correctly. And then you'll see why the symptoms of this are so broad and random and could be all sorts of other things. And that's what makes actually like pinpointing it hard, or it's just a blanket diagnosis if someone doesn't want to do a little bit more investigative work to actually understand the root cause. But what's important to know about PCOS is it is a lifelong condition. There is technically no cure, but it can be monitored and managed. So infertility is one of the leading symptoms. So a lot of women get a diagnosis when they are trying to have babies and then they can't. This is one of the main reasons that bring women to the doctor to actually see what's going on. But if someone, wasn't interested in having kids, or they're too young or they're older, like this can really fly under the radar because you're not concerned about fertility. And I think fertility is something that makes people take their healthcare or lifestyle, whatever, actually very seriously, probably more than any other thing out there, from at least from what I've seen so far.
Absolutely.
One thing to keep in mind about a syndrome or anything like irritable bowel syndrome is a syndrome just means it's a cluster of symptoms that correlate enough to determine like a diagnosis, but it doesn't actually mean there's no like where autoimmune you can kind of get a blood test to confirm antibodies or something. This doesn't really work that way, but it's just a cluster of symptoms. But this also makes it very vague and hard for people to pinpoint once they know that they have it. We're not really sure what causes it. There's no very clear cause, and the root of PCOS is usually a combination of genetic, environmental, hormonal, ovarian, and metabolic dysfunction. It could be all of the above or a couple of the above that lead to something. One thing that is very common across PCOS cases is obesity. It's not always the case, but it is very commonly associated with that. Sometimes obesity is a cause, sometimes it's a symptom. It kind of could work either way there, but the point is we don't exactly need to know exactly why you have PCOS if you get a diagnosis, but we can just look a little bit deeper to find the root cause. The symptoms are very important here, and this is how people get a diagnosis. No two women's experience with PCOS is exactly the same. So for myself, I have been formally diagnosed with PCOS 2 different times, probably 8 years apart. And 2 completely different doctors, like they had nothing to do with each other. The first time, it was before I was into like functional nutrition. I just didn't really understand what was going on. But at that time, I did have cystic ovaries and I did have insulin resistance at the time. This was when I had like other stuff that I shared in our hormone episode, but like rapid weight gain. So this kind of correlated to that. And then the second time around, I did not have any cystic ovaries. So like all the cysts were gone. And I didn't have insulin resistance, but I was not ovulating and I had slightly high androgen levels. So 2 completely different things that allowed me to get diagnosed, but that's kind of the funny part. And the first time around, I really felt like this doctor was not interested in getting to understand me better. I was young. I didn't know how to advocate for myself, but I was just put on metformin, which also didn't do anything. But that was like the answer for that at the time. And then I just kind of was like, on my own doing my thing. Once I got into this wellness stuff, I think it kind of managed itself, but I didn't obsess too hard around the diagnosis either, because when I did research, it was also like, well, this is like very broad and unspecific. And my second time around, I was just kind of like, I'm not really sure this is really what's going on, but I knew the root cause pathway well enough to take a deeper look there and address those things. But just want to really keep in mind, no 2 women's experience is the same. So if you have PCOS and your friend has PCOS, you could have completely different bodies, symptoms, but you still have the same diagnosis, which is also what makes the treatment or what to do about it really, really confusing. Because if you're not obese, you don't need to address your obesity. And if you are obese, but you don't have cystic ovaries, you don't need to address your cystic ovaries. So that can get really confusing. But there are 3 hallmark symptoms that I guess most people have when they have PCOS, and that is obesity, irregular menstruation. So that could mean you're not getting your period, or you're not ovulating, or it's just really irregular and maybe happens a couple times a year, but it's definitely, there is no pattern, and it's definitely disrupted in in some way. And this is also why the fertility issue comes into play, because when you're not ovulating, you can't get pregnant. So women need to ovulate. So that's why they actually like go get looked at. And then the last one is hair or skin problems. This is usually acne, facial hair, or scalp hair loss. If women have hair on their face, it is a sign of hormone imbalance. This is incredibly embarrassing for women to also either have or to experience or to share with someone. But you definitely can grow a little bit of facial hair. Side note, I know this is really common after pregnancy. Women will get a little bit of like darker hair patches maybe on their face. That should resolve itself and go away. That has a lot to do with just like hormones kind of floating around in the body. But if that doesn't get better and all of a sudden you're getting like legit, almost like, patchy beard-like facial hair, that's definitely a sign that something hormonal is going on. And then scalp hair loss. So just like your hair is thinning over time to where if you look at the top of your head, it's, you could probably see parts of your scalp. Like the hair is just thinning. This doesn't happen in a drastic, like you shed all your hair at once. It just might happen over time to where all of a sudden you're like, whoa, what happened to all my hair? But you just maybe didn't notice it happen over time. But those are the three main things that are most common. But these symptoms are so broad that also include really quick weight gain or resistance to weight loss. I would say for me, when I was in an insulin resistant state that I didn't even know I was in, I gained weight really quickly, and it was actually really scary for someone who also was into like fitness and stuff. You're like, what the fuck is going on?
Yeah, wow.
But it really was rapid, and I would say it wasn't, yes, my habits were not like they were now, but they definitely weren't what they should to cause that much of weight gain in a short amount of time. So that's one thing to look for if you're just really gaining weight very quickly, or you are highly resistant to weight loss. Like you really can, if you have PCOS, do a lot of things and not lose weight, but it's just because you're not targeting the root cause. But those are two really big symptoms. Fertility issues, like we said, acne, having polycystic ovaries. So you can have cysts all over your ovaries and not have PCOS. You can also not have cystic ovaries and have PCOS. But the cystic ovaries are a common thing. I know for me, when I had that years ago, so this had to be in my mid to like early 20s, mine were driven. I switched to an IUD. I went from the birth control pill, switched to the IUD, and then afterwards, of course, I was like doctor hopping in New York. I was ZocDocking, like wherever I can get an appointment. No one's taking me seriously anyway, so like I'm not loyal to any doctor. But then they would be like, oh yeah, switching to this one increases the risk of, cystic ovaries. I'm like, cool, great. And then I, went through the whole thing of where they would actually pop and it would be incredibly painful. But that's a part of it. And I think no one knows the status of your ovaries unless you go get an ultrasound. So if you're curious, go to your gynecologist. You can get an ultrasound. They will be able to determine that. There's really no other way to figure that out. Type 2 diabetes and insulin resistance, huge for PCOS. If you do not figure out your insulin resistance, you will develop diabetes. And then you have a whole slew of other issues on top of the stuff that also triggered the PCOS. Sexual dysfunction's another one. Of course, like we're talking hormones here, so you could have, all sorts of issues with like libido or, just your functioning of your genital area is definitely part of PCOS. And another reason there's a lot of shame and why women don't talk about this stuff is because they are embarrassed and they don't know how. And then poor body image and eating disorders actually has a strong correlation with PCOS. And then pelvic pain. And those are just a few. There's like a humongous list of symptoms, but I think those are some of the most common ones. But of course, those symptoms could be anything. And that's why this is really tricky. But also, symptoms can cascade from other symptoms. So, for example, if you have insulin resistance, you could develop cardiovascular disease. You do not have cardiovascular disease because you have PCOS. You have that because insulin resistance is, creating a situation in your body that develops this. So this is why people with PCOS tend to develop all sorts of other conditions, or they are just some of the worst metabolic health people I've seen, or they're on all these medications, they don't get answers, or they're just like passed around from endocrinologist to that next doctor or whatever, because the symptom variety is so vast. And if you're not seeing a functional medicine doctor, doctors stay in their lane. So they're like, cool, I handle this part, but if you have that, you have to go over there. And now we're not getting consistent treatment, and you don't even know why you're having all of these developed symptoms. And that can get really tricky. But The diagnosis part, I think, is important for women to also get some clarity, and the diagnosis does have to follow a very specific criteria. This is also part of, being a syndrome, is you just have to meet certain criterias for diagnosis. So the three things are, for a formal diagnosis, like from a medical doctor, is ovarian dysfunction, so you're not ovulating. You have high levels of androgens, so DHEA and testosterone is high. Those are like the more male-dominant hormones. That's why it can cause the facial hair or the scalp hair loss. And then the last one is polycystic ovaries. So if you just have 2 of 3, you will be formally diagnosed. Birth control drastically interferes with these results. So birth control is a whole nother thing. But if you're on birth control, maybe we don't know that you're not getting a period. It's really hard to say. And so many women are on birth control. So a lot of this stuff is just very hard to pinpoint. And I always tell women this because nobody thinks about it. If you're on birth control, but you're going to get your hormones tested, those are your hormones on birth control. It's not actually what they would be if you weren't on it. We'll never know what's actually going on because your hormones are being controlled or largely controlled by taking birth control. So that's why when women come off of it too, all of a sudden they have all of these issues. And the tricky part is birth control is often a treatment for PCOS. So now we have that going on. But your lab work is necessary to check out your hormones and to also check insulin and your thyroid and other metabolic factors. So if I had someone come to me and they're like, oh, I have PCOS, I'm not only looking at testosterone and DHEA, I'm looking to see everything else, but especially their thyroid and insulin levels, because we can test by your blood insulin to see if you're insulin resistant or sensitive. That's also really helpful in relation to A1C or blood sugar, all of that stuff. So like everything else that we talk about in the functional world, it's a combination of things, but you will not get a diagnosis if you don't have blood work done or, you're not going to a doctor to actually confirm these things. But
there's one thing I want to emphasize there, because you mentioned it a couple times. There is a term that we've never used on this podcast, but we use it a lot, Kat, which is comorbidity. And comorbidity, it's a medical term, but it's the presence of more than one medical condition. Could be a disease, could be symptoms that are often have the same primary cause. And so when it comes to functional nutrition, we are often working on mitigating symptoms of comorbidities. Just to give you an example, you've mentioned obesity, insulin resistance. Another common one is blood pressure, kidney disease. If you were to see a doctor for each of those, you would need a nephrologist, an endocrinologist, a PCP, an OBGYN. You're going to see 5 different doctors. You're going to get 5 different diagnoses. You might even get 5 different medications. And yes, sometimes that is the only way to do it. But PCOS is just such a good example of why all of the choices you make in diet and lifestyle come back to these comorbidities. And maybe sometimes remembering that the root cause and treating it at the root level is really going to give you just so much more peace than, as Kat mentioned, her personal story, bouncing around from doctor to doctor. So remember comorbidities. It's a very important thing to consider when prioritizing your health.
And I will say also on that note, I think, a lot of people are dismissed by the standard medical system, but especially women who or present as healthy but have these symptoms, or overweight women are also often dismissed in the medical community. So if you have these things, you might just have to extra advocate for yourself to get answers and demand labs or testing or whatnot. I know I've had to do that a lot for me, but you can't always rely on them to do the best, because a lot of these things, and the reason women have PCOS and it's drastically underdiagnosed, is because it's not often recognized, or maybe you get a diagnosis and now we're not doing anything about it. But on the positive side, lifestyle factors are by far the most effective way to manage PCOS. So this is where I think there's a lot of hope in this condition, is that it's so dependent on your lifestyle, and you really can manage your symptoms and get rid of them if you just change your lifestyle. Depending on where you're at when you get diagnosis, or I would say the intensity of which it's impacting your life, this also can make a big difference. So for myself, I think it took pretty minimal things for me to completely forget I have been diagnosed with PCOS. I actually forgot about it, to where I'm oh yeah, I did have that. I think part of me was always a little skeptical at the time, but I think the things I have done whether I'm aware of it or not, have just helped keep a lot of the symptoms down. But if I start living, poorly, or I change my diet, or I start eating a bunch of sugar, I'm sure that would come right back because, I have to manage it. So that's one thing I think is just so important for women. But if you are very deep down a cascade of having all of these metabolic issues and you're obese and your hormones are off, it's not a very simple fix, but if we break it down, it is simple on what you can start doing, but it will feel like a lot and like you're up against a lot, but it just depends of like the progression of where you're at the time. But medications will often be suggested, especially by an endocrinologist. The main ones they will use will be metformin, spironolactone, and birth control. So none of these will work if there is no lifestyle change in addition to, and I think I've worked with plenty of women who have been on metformin and noticed nothing, like absolutely nothing from it. I don't exactly know why or whatever. They play around with dosages and stuff like that, but I think, just a medication won't make a huge difference. However, birth control, because it does control your hormones so much, could quiet things down, but then you come off of it at some point, or maybe it's time for you to want to have kids. You don't want to have to then deal with your infertility then. You want to address the habits, if you're on medication, to just make things work a little bit better or be a little bit easier for you. And I am not being dramatic when I say that a holistic approach can reduce, if not totally eliminate, your PCOS symptoms. Like, I really believe that to be true. There are so many women who are in this place as well, but you just have to take a holistic approach, which doesn't mean like herbs and stuff like that. It just means thinking of mind, body, your emotional and stress, like all of these things really play a huge role. But if there's a couple things we really need to focus on, one is losing weight and keeping it off. If you lose 7 to 10% of your body weight and then you keep it off, you could drastically reduce symptoms. That's not that much weight, but that can make a huge difference. But a lot of people, due to, the insulin issues or whatever, losing weight is hard and their bodies are resistant. But I actually think this isn't that challenging if you are doing the right things, which is not a low-calorie diet. It's not intermittent fasting or like eating one meal per day. I think you really have to just monitor calories in versus calories out. Pay a little bit attention to your macronutrient breakdown to make sure you're not eating 100% carbohydrate. We need to eat high-quality food most of the time, not 100% of the time. And you need to manage your stress and eat balanced meals. All of those things will really help with weight loss and keeping it off. And the fun part is you don't necessarily have to do all of those things at once. You can start with one at a time and just slowly build. Slowly build based on your comfort levels. But if you are overweight, your goal should be to lose weight to help reduce the PCOS. You do not need to get rid of PCOS first to lose weight. That's backwards thinking. But if you just focus on the weight loss, I think that can have a really drastic impact. And then some people just lose a little bit of weight and then their period comes back, they're ovulating, and then once you're ovulating, the body is happy and things start to rebalance itself out. So it really can just be as simple as trying to lose, that first 10 pounds and then going from there. If you are not overweight, which was the case with me, for the most part, and I think is the case for a lot of women too, is you're not overweight, and that's where we look at managing your insulin resistance. When you are in a state of being insulin resistant, this means the body is less efficient in processing and managing glucose in your bloodstream. When insulin is not able to lower your glucose levels, the body will store it as fat. And this is how type 2 diabetes develops, along with a lot of other things like gastrointestinal issues, even depression, or atherosclerosis, which is when you get that plaque buildup in your artery, the bad things that cause, heart attacks and all that scary stuff. This can happen when you are insulin resistant, and you need to know that you don't need to be overweight to have insulin resistance. This is, most people wouldn't be aware of this, but you just have to think about your energy levels. If you are having really strong cravings and your blood sugar drops really quickly, you get hangry, you get irritable, you might have some insulin resistance issues. Or sometimes it's someone who looks relatively slender but has a lot of belly fat. A lot of belly fat just accumulated in that area. We could have some insulin resistance going on. But like weight loss, we have very clear things we can do to improve your insulin sensitivity. Managing your blood sugar by eating balanced meals. So that means, protein, fat, fiber at every meal throughout the day. That can have a incredibly drastic impact on your insulin sensitivity. And then this is where exercise comes in. Exercise and strength training have great impacts on your insulin, and more muscle mass you have, the more insulin sensitive you'll be, and that's why people who have a lot of muscle mass can eat a ton of carbohydrate and still be healthy and not get fat, is because they have the muscle mass to help regulate that. So strength training and trying to build muscle or not lose muscle should be a priority there. I don't think you need to do excess cardio, but aerobic activity is helpful here. But I would say walk and lift weights, and then if you have room to add more intense stuff in, great. But if you just do those combined with balanced eating, I think that can make a huge difference.
I want to emphasize all that because you just outlined a lot in terms of managing insulin, prioritizing the right food, strength training, cardio. All of this goes into your insulin resistance and your weight and all that. Most people don't do this all. And that's okay, right, Kat? We have coached hundreds and hundreds of people. We've yet to have someone enter our program and be like, you know what, you're doing it all right. Here's your money back. Like, good luck to you. I think everyone needs help, and that's okay. But it's really important to remember that mentality, because if you go to the doctor and you have PCOS or you're overweight or whatever, they're going to ask you how your diet and exercise is. They always do, because doctors are smart. And most people are going to say, oh, I'm actually doing really well. Like, I eat healthy, I work out. And it's like, but you're not doing all of the things that Kat outlined. And it's really important to have that mentality, because that's why you get the prescription that maybe isn't going to help you, because the doctor's not going to tell you to leave. They're not going to say, you're a liar, go work out 3 days a week and show me the proof, because they only have 20 minutes with you and they want you to feel better and they want to help you. And so they're going to write you the prescription, when the reality is there are other things you maybe could be doing. And not always. But remember that we have a ton of free resources around this. We have the link to our Ultalife community in the show notes, where we have lots of free guides, lots of free resources to help you with this. But just remember, most people don't do this right. I'll put myself in that camp of, like, I'm always trying to incorporate more cardio and do more resistance training and improve the quality of food. Like, it's just hard. So have that mentality, be open-minded that there's more to it that could really help feel better, mitigate the symptoms, all of that. Kat, I'm sure you agree with everything I just said.
Yeah, so true. And I think that leads me to my last point of stress management. Like, PCOS is incredibly isolating. It's discouraging. When we have women in our program or people we speak to before they sign up, when they have PCOS, there tends to be like a truly low confidence, low self-esteem, feeling like there's no hope, feeling like this condition is like taking over your life. And I'm not going to say it's like a victim mentality, but I think a lot of women are like, oh yeah, I can't do that because of my PCOS, or oh, I have to use like fertility medication or do IVF because I have PCOS. Like, there's a lot of things that people say and they talk about it like they can't not have it. Right? They speak about it as if, like, I have this thing and that's why this is really hard for me. And it's almost like there is no hope or no opportunity to improve. And I think that's a bummer to hear from people, because there should be at least hope, knowing that there are things you can do that you're just not doing now. But stress management is really, really important. And I think we've obviously talked a lot about how stress can lead to inflammation and disease and all of these things. But a lot of women with PCOS have terrible boundaries. Maybe they're not sleeping. They might be exposing themselves to all sorts of toxins that they aren't aware of, eating really like unhealthy processed foods, fast food, or like eating their kids' meals and whatnot. These are all things that accumulate stress that you might not be aware of. If we call them hidden stressors, they're hidden because you don't know they're stressing you out. But if we bring awareness to the things, or it's like, hey, if you just improve your sleep, or maybe you have some boundaries with like your friends or something like that, or like your mom or whatever, like, we could actually decrease stress, which makes you feel like your body is a little bit more resilient to doing the things, or getting that workout in, or making some dietary changes. We just have to reduce the load on you that's making you feel like there's nothing you can possibly do. How that looks for you is very individualized. This is why no two women should have the same approach for their PCOS, because you don't have PCOS for the same reason. But I promise you, if we do a deep dive into all of these factors in your life, it's probably not going to be all that confusing on why you have this condition. You just aren't aware of it. And your doctor's probably not breaking it down for you. I know I got absolutely no explanation. Actually, the second time I got diagnosed, I was on the call with my endocrinologist, and we hung up the phone, and then she sent me a message and was like, oh, by the way, you have PCOS, because I just realized you have this other marker, and now we hit like 2 out of 3. But she was just like, sent that in a message. I'm like, cool. I'm glad I know what this is so I can handle it. But oh my God, like if that was the first time someone learned that and that's how that's being delivered, and we have no hope except here's a prescription at CVS, no part of that was mentioned about like diet or lifestyle or anything. And I also know that was because she like looked at me and was like, you know what's going on, or like, you're a nutritionist, like, you know this. And, you know, to me, that's like shitty to hear. But I know for people who have no clue what's going on, that must be like incredibly confusing and isolating. And if you just don't address your PCOS, it will compound into bigger and probably more intense things. That the root cause of your PCOS, now we are like miles down the river in a different situation. So you want to address it as soon as you can, or as soon as you're aware that you have these things, but it is never too late. I think that's another really important thing. You're not, you know, too unhealthy or too sick or too hormonally imbalanced to get back to baseline, because your body wants to be in baseline. And if you're a woman and you're in the age in which you should be ovulating, that's the only thing your body wants to be doing. And if you're not ovulating, something is very off. So just keep those things in mind. Like, your body can get back to baseline. You just have to give it the tools.
Love it. We have put together a small course for this because there are so many questions, because it is so variable, because it can be mismanaged sometimes. Hosted by the amazing Kat, who knows a lot about this, has gone through this experience herself. So we'll put the link to that in the show notes as well. It's a very small fee, not because we want your money, but because we don't want you to be one of those people who hoards a bunch of free stuff and then never watches it. And we know that if you pay just a little bit of money, you will actually watch it. You will learn a ton. And then you can reach out to us with questions as part of the course. You get access to us to help you, guide you on your journey so you don't feel lost. So make sure, if you have been diagnosed or you're not sure, or wherever you are on your journey, strongly recommend taking this. It will really make sense of a lot in addition to everything we covered today.
Yeah, there's a lot of stuff here, but, you know, we just need to start big, and then we can always get really small, you know, once I know a little bit more about you. But I don't want to give hyper personalized advice when I don't know you or anything. But these you know, solutions of like weight loss and insulin resistance, this is just important stuff to focus on. And then once you're in the course or whatnot, if you have more specific questions, we can do a deep dive into that.
Love it. Anything else to add, Kat? We covered it all. I mean, as much as we can in 30 minutes.
Yeah, I mean, there's so much to it. I think there's, you know, you could research endlessly, like by Googling stuff around, but if that makes you feel a little bit more overwhelmed, then I would say don't do that. But just stick to like really simple advice, or just go on walks, eat some more protein, like just do the most basic things that we talk about in every single podcast episode.
Love it. I love it. Well, you can get more from Kat Best Wellness. You can follow me on Instagram at Andrew Hayes Life. You can find the link to the course in the show notes, where you'll also be able to reach out to us with questions. We'll see you for the next one, everybody. Thanks.
Thanks, guys.